Hi, I'm Jeannie Di Bon, a Pilates and movement therapist, and I'm based in London in the UK, and I'm here today to present on Pilates and movement therapy and how it can help with hypermobility and EDS. I have no disclosures to declare. So just a little bit of information about myself, how I've been teaching since 2008, and I am the author of Hypermobility Without Tears, which is really about my method and how it helps with my hypermobility. And I do specialize in working with people with hypermobility and EDS. So 99% of my clients have this condition, and I see them on Zoom or face-to-face in my clinics in London. So maybe there's many of you in the audience who do Pilates, and it's often recommended by our medical professionals because it's a safe and effective method of strengthening the body. But what is it? The Oxford Dictionary describes it as a system of exercises using special apparatus designed to improve physical strength, flexibility, and posture, and enhance mental awareness. And Wikipedia calls it a physical fitness system developed in the early 20th century by Joseph Pilates. And Joseph Pilates called his method contrology. So it wasn't until after his death that it became known as Pilates. And his original 6 principles of concentration, control, centering, flow, precision, and breathing can be relevant to us as hypermobiles as well. And I didn't mention in my beginning slide that I do also have hypermobile EDS. So my clinical experience since 2008, plus my personal experience, goes into all the work that I've done in creating a method for EDS and hypermobility. But, so Pilates, we just heard what it is. What's right for my body, though? Because as we know, EDS is a very individual thing. Some things that are right for someone might not be right for someone else. And as you can see in that picture, that's quite an excessive, big exercise. And as it says there, not every exercise is going to be suitable or necessary for everyone. Do we really need to be doing that exercise for our daily functional living? Probably not, unless you're a dancer or something like that, or a gymnast. But there's lots and lots of types of Pilates. So you might be doing mat Pilates, you might be doing classical Pilates, you might have done Pilates on a reformer, which is what this machine that is in the photo is. There is high intensity Pilates, there's cardio Pilates, there's all sorts out there on the market. You can do it one-to-one, you can do it in a group. But you have to be aware that there are different schools of thought out there. Obviously, there's lots of different training schools, hundreds and thousands of different teachers. We've got to find the teacher and the school that is right for us. Okay, so it's important that we do our homework first. And of course, Pilates is not a replacement for any medical treatment that you might be receiving. And I always do say, always check with your medical practitioner before you do start any kind of new exercise. But it's important to remember that Pilates is a method. It was a method created by Joseph Pilates. And like with any method, it's going to have its limitations. It's great. I trained in Pilates originally back in 2006. It is the foundation of how I teach. But I became very aware that it is a method that has limitations, especially when it comes to hypermobility and EDS. Now, these are just some of the more advanced exercises that can appear on a reformer or on the mat in a Pilates repertoire. Now, there might be people listening that are able to do all of these things. So I'm not saying we shouldn't be doing them, but from my experience and the clients that I see, much of this isn't accessible, and it's not really functional for their everyday activities. So the other thing about following a method is that its aim is to progress you from being a beginner all the way through to being a sort of a more advanced practitioner. Now, is that going to be suitable for us? Do we want to be advancing so that we can roll over and put our feet behind our head? Maybe we've got cervical instability, maybe we've got lumbar instability, maybe we've got hip issues. You know, there's so many things that could be going on that make so much of this not quite right for us. But again, I'm not saying if you do this and you enjoy it and it, you know, I'm not saying we shouldn't be doing it. I'm just saying that for many of us, it's not always accessible. Now, when I started studying Pilates and then I started to expand my thinking about how I could help myself, first of all, with the chronic pain I was suffering with my hypermobility, but how I could help other people. And I'm always drawn back to Professor Graham's comment that no other disease in the history of modern medicine has been neglected in such a way as Ehlers-Danlos syndrome. So we think about the implications of this, the neglect, that you know, with diagnosis, with the right treatment plans, the anxiety, the stress that goes with having a condition that maybe we didn't get diagnosed, or you know, we didn't get the help that we were needing. So I wanted to take that into account. So what is my form of movement therapy for hypermobility? So I knew that it had to be unique to the individual. We know that there are a big spectrum of people with different levels of ability with our condition. I knew that I had to create something that worked on our physical symptoms like chronic pain, joint instability, subluxations, being stiff but also very flexible in certain places, having headaches, the flat feet, proprioception issues, all of those physical aspects. But because of that side of the neglect that we refer back to Professor Graham's comment, I also knew that this had to deal with the emotional and psychological side of living with this kind of condition: anxiety, tension, stress, fear of movement, lack of confidence, and a feeling of isolation. So as I said, my method does have Pilates at its heart, but I've modified it to appropriate, safe, effective, and importantly, functional. What do we actually need to enable us to function effectively and importantly, pain-free on a daily basis? So I studied mechanics, a lot to do with the feet. So I studied gait in depth, to help people with their painful walking, their standing, their alignment, their joint pain. And I also studied pain science, some neuroscience, and I'm not a neuroscientist, but I'm really interested in the pain science. So I want to educate people about the workings of pain, because this can help calm the nervous system, the mind, and the body. So I'd call the work that I do movement therapy as opposed to pure Pilates, because it's encompassed many, many other things apart from just following a strict method. So yes, it's an integral movement method, but it's not following strictly just Pilates as we saw in the photos. Now, as we refer back to Professor Graham, what are the outcomes for people who have maybe had that neglect that he was talking about? So there is no clear pathway oftentimes for people with EDS or HSD. People are treated in a fragmented single body part care rather than holistic, looking at the whole body and the mind and the body. People are led to have frustration, they're disbelieved, they lack confidence. Unfortunately, there's, you know, people report that the medical profession doesn't always have understanding, and they have an overcautious and hands-off approach. And people are often misdiagnosed, you know, fibromyalgia. Maybe they've been told they're lazy, they're fabricating it, they're depressed, you know, all these things we know go on. And then these misconceptions that, you know, hypermobility does not mean you have a hypermobility syndrome, but also just because you have a low Baton score doesn't mean you don't have hypermobility. So there's lots of confusion out there as well. And this is what I see in my patients, that, you know, because of this neglect, we often have these issues going on. Things I hear from my clients, and some of this might sound familiar to you as well. Maybe you've experienced, you know, pain is part of my life now. I live with my pain. I can't do that anymore because of my pain. I don't like taking my pain medication. It's normal to feel like this. I'm too tired, and I'm scared that I'm going to hurt myself or hurt my back. These are things that I hear regularly when people first come to see me. just a quick word on the pain cycle and exercise. We do often have pain. One of the, most people come to see me because they have pain. So I know that we have pain. Now, when we're in pain, especially when you've been in pain for a long time, it does cause fatigue and it does cause stress. Now, when we feel like that, it's very, very hard to get motivated to do exercise. That's totally understandable. But the problem we have is that we do decondition quicker than other people. It does take us longer to get stronger than other people. And the longer this goes on, it will lead to increased pain. And of course, that will lead to increased fatigue and stress. And so we find ourselves in this vicious cycle of pain, fatigue, and stress that just gets bigger and bigger. Now, my job and jobs of other medical professionals and physical therapists is to kick in at that point where we say we don't want to exercise. That's exactly when we want to start doing the exercise, okay, so that we can break this cycle. And, why do we need to be doing exercise? So I just mentioned briefly that we do decondition quite quickly compared to sort of non-hypermobile people. And the book Understanding HEDS and HSD by Claire Smith is a really great book. And she mentions that we do need to retrain or increase our muscle strength and tone as much as possible so that the muscles can compensate for the effects of defective connective tissue in other supporting ligaments, structures such as ligaments. EDS awareness reported that 70% of adults reported having chronic pain before the age of 20. So that's a huge number. And research by Chiletti, the fear of movement should be assessed and managed and is associated with pain and fatigue. So with an appropriate movement therapy program, we can start to address all of these issues, okay? And we can get to people feeling like this. So these are just a couple of comments from some of my clients. So after they've been working with me, they say it makes them pain-free. It means that they feel strong and together. It gives them awareness and control. They were scared at first, but now they look forward to it, and it gives strength and stability. So these are all the things that we're looking for, okay? And it is definitely possible with an appropriate program that's functional, safe, and effective. So how do we do it? So how do we build a program for someone with EDS, HSD, or symptomatic hypermobility? So it is Pilates based, but it's evolved from rehabilitation, pain management, and a very somatic focus. Okay, I don't take a mechanical approach. It's not about being perfect. I like a 360-degree approach where we do look at the whole body and mind working together. You cannot separate the two. The mind is going to influence the body and vice versa. So through my research and, as I say, working with myself first, because I had chronic pain from a very early age, and I rehabbed myself out of pain. And that's what I do now to help other people get out of pain. We look at 6 elements, which I'm quickly going to run through now so we can understand those elements a little bit better. So breathing, relaxation, proprioception, joint stability, balance, and posture. And what we're looking for is this adaptable base. So you build those foundations that then enables you to go and do everyday living, pain-free, exercise, or even sport. Some people want to go back to playing sport. I've had clients who go back to playing golf, tennis, hiking. One person's just gone back to figure skating, which is just amazing. So all sorts of things are possible. Okay, so let's dive into our breathing. Why should I be thinking about breathing? I know how to breathe. We're all here. We're all breathing now. But actually, so many of us have to relearn how to breathe. I found over the years that many people with our condition do have breathing pattern disorders. And those can arise from many reasons. Pain is one. Maybe it's painful for me to take a deep breath. Maybe I'm scared to take a deep breath. Maybe I sublux my ribs on a regular basis. Maybe I've been anxious and stressed and scared, so I get very closed and tight with my body, and that's going to affect my breathing. There's so many things that can impact our breathing. So when I first meet someone, one of the first step I do is we look at breathing, because when you start to look at the breathing, you start to already build body awareness. And we know that we tend to lack body awareness and sensory awareness, lack of proprioception. So it's a very easy, safe way to start building that. Breath comes first, movement comes second. So we learn how to incorporate the breath into our movement. And it does reduce pain. When you start to breathe, and we'll move on to our second point, relaxation, tension starts to leave the body. So it has actually, on a number of occasions, all we've done is breathing, and they've come back the next week and said, wow, I feel so much better, because their pain has started to go down. So these holding patterns, when we don't breathe properly, can cause pain. And, we're not talking about maybe going away and learning meditation, but it is known that meditation can help muscle relaxation and interrupts the signals from the brain about the pain. So we always spend time doing this. And that goes hand in hand with my second point, my principle, which is relaxation. It's integrated to the breath. It does start to release those tensions. And as I said, holding patterns. Sometimes we're not even aware that we have these holding patterns. Maybe I hold my shoulders up to my ears. Maybe I brace my tummy muscles or guard my tummy muscles, protecting myself. And these are all perfectly normal responses when you've been living with a condition that maybe you haven't been sure how to manage. So we become very protective of ourselves. Nervous system response. So when we start to relax, we start to trigger the parasympathetic nervous system. Really, really important, because in my opinion, so many of us live in our fight or flight systems, always on alert, always ready for something to happen, which is fine, in very short bursts. We need that, but not living it 24/7. That's exhausting, that's fatiguing, it's stressful. So we want to spend more time in our parasympathetic nervous system. Proprioception, so really important for us. We start to incorporate little tools like bands and balls and things like that, still lying down for a lot of the time, nice and supported, nice and safe, to help build awareness, control. We start to explore movement without fear, and we keep the range small. So I always say, just because we can doesn't mean we should. So just because we can do big movements, and maybe you can do party tricks and do the splits and do all sorts of things, doesn't mean we should be doing it, because the more we go big range, the more loose, I guess, the ligaments are going to become. We want to reduce the range of movement, because that's the only way we can start to feel control. Now, I know this is a slightly different opinion, but I found it's really the most effective way of helping reduce pain and injury, because if we keep going to end of range, but we don't know what it feels like to control that joint, it's going to be very hard to build control at end of range. So how about we make the range much, much smaller so people can feel control without stressing their joints, okay? Joint stability, we start to come up from the ground, maybe do, a little bit more challenging exercises. We start to feel that core control, that protection of our joints. And we're really looking for no pain, no strain. So I don't believe in pushing through pain. I think we have to listen to our bodies, certainly not straining it. It's not a no pain, no gain strategy. And there's a photo of my feet there, because, joint stability really starts at the feet, and then we work our way up through the rest of the body. Balance, an important part of everyday life. This is coming towards the end now. So learning to sort of walk is an act of balancing. We want to integrate the whole body. So you've got stability in your whole body and strength in your whole body. And of course, posture. Posture comes after all that hard work. I don't believe posture can be taught, not in a lasting way. Of course, intellectually, I can explain to you what a good posture looks like. but that would probably cause you more work and more stress because you'd be trying really hard to maintain this posture. But if we train the whole body and mind, this lovely posture emerges from a body that understands good organization. So you have whole body awareness and integration, and you have good tension in your body. We do need tension in our body to hold us up. Otherwise, we would all collapse on the floor. But there's a difference between good tension and bad tension. So just a couple of very quick quotes. This is from one of my clients who's hypermobile. She suffered pain and injury her whole life, but through working on this program, she can now sleep, stand, walk, and exercise without pain. That's the sort of results that we would be looking for. Okay, Henry, another hypermobile EDS client, working on this mindful focus movement allows him to listen to his body again and release the tension and bracing or guarding that has become a common daily feature. So when you start to release that tension and guarding from the body, your body can start to move with much more freedom, but controlled freedom. Okay, so really, really important we look at all those elements. Very quickly, I always get asked whether we should be stretching. Is it a good or a bad strategy to do these big stretches? So I always think that we're stiff for a reason. So many of us are flexible in some joints and very stiff in others. You know, and those stiff bits are trying to compensate for the very bendy bits. So if we go and stretch and stretch and stretch and destabilize those stiff bits, the chances are we're going to have more pain because the body's going to kind of freak out and say, well, what's holding me together now? Yeah, so it will probably get tighter anyway. Joints will stretch before stiff muscles or fascia, so we don't want to be stretching those joints more already. We don't want to make them laxer. And pushing and forcing a stretch is not recommended because you could go too far. We can often bend into these big things without realizing, and it can cause pain afterwards. So nothing really changes with static stretching. Research has found that static stretching doesn't really achieve much. But I recommend dynamic stretching, where you move in and out of move in and out of a stretch, so that you're getting some nice fluidity through the tissue, but you're not going to those end of ranges and maybe hanging off joints and just giving that sort of unnecessary stretch. Because what we need is elasticity, not more bendy bits. So I want to teach my body to be more elastic rather than more bendy. So quickly, a moving strategy, if you were starting out today, we're looking for closed chain. That means where you're getting lots of feedback, lying on the ground, your feet are touching the ground, you aren't balancing on one hand like in this second photograph. Yeah, you're nice and supported. As we mentioned earlier, we want a short range of movement. We're looking at motor control. And we want simple choreography. So we wouldn't want to be throwing our arms and legs in different directions. Keep it simple. Learn those foundations very slowly. And again, with a few reps, few repetitions. So until we know how much your body can tolerate, how much your tissue can tolerate, we don't want to get you doing 100 reps of an exercise because we need to make sure we've established a good, healthy baseline. So a few reps is absolutely fine. Tactile feedback, if you're working with a teacher, put hands on and give you some feedback, brilliant, helps build your sensory awareness. Low loads, don't go and have heavy loads, don't go lifting heavy weights when you're just starting out, and try and incorporate the isometric, the eccentric, and the concentric elements to your program. Limited change of position, especially if you've got POTS, you don't want to be standing up, sitting down, all sorts of things. Keep it simple, and really important, little and often. Movement versus exercise. Remember, exercise doesn't always have to be a formal class. You can build movement into your daily life and everything counts. You know, some people really beat themselves up because they think they haven't done something, they didn't get their mat out, or they didn't get to the gym. Being mindful about the things you do at home, taking gentle walks, that's all going to count. So, you know, sometimes we have to be, and we should be, gentle with ourselves, okay? So small final thoughts. I'm a firm believer that everything counts, okay? Progress, not perfection. So if we're taking those little steps day by day, that's what counts, not trying to be perfect, and certainly not comparing ourselves to other people, okay? Moving with awareness is going to help improve our lack of injuries, reduce our injuries, improve our proprioception. And remember that first quote from Professor Graham: if I make a small physical step, it's going to be a huge emotional step for me. It's going to start helping me feel better about myself and my abilities. Self-belief, really, really important in what we believe we're able to do. And, you know, resilience. The more we work those little steps, we're going to feel more resilient. We will become more resilient. And pacing is essential, but I believe it's your pace, not a sort of a predetermined pacing program that somebody else has written. You know, it has to be at your pace. We're all different. We all have different tissue tolerances. We all have different abilities. This is your journey. It's about your pace, not trying to fit into a box of what someone else has said we should be able to do. And be reassured that research has proven that exercise is good for the body and mind. And just finally, the approach to our exercise is key. Everything we've just talked about, the approach we take is really, really key. Okay. So that's just further information. If you want to get in touch with me, I'm on all the social medias. And my website is jeanniedibon.com if you wanted any further information. But thank you so much for taking the time to listen to my presentation. And thank you to the EDS Society for hosting me today.